morning, everyone. Welcome to the 69th Institute Day celebrations. Before we start the proceedings, I would request all of you to either switch off or put your phones on silent.
To felicitate the orator, please. Years of life, contributions to science and society. This oration is held every year at the time of the Institute Day celebrations, and intellectuals are invited to deliver the oration on a subject of their choice. The past orations were delivered by Professor Balram Airan, Dr. Shaji K. Kumar, Dr. Rakesh Agarwal, and Dr. Rajiv Behel. For this year's oration, we have Dr. N. Kalaiselvi, and I request the Dean, Professor Kaushal Verma, to introduce the orator. Thank you, sir.
Thank you. Good morning, everyone. Honorable Director, Professor Srinivas, Dr. Kalaiselvi, my mistake, apology, Director CSIR and Secretary-DSIR, distinguished members of the faculty, members of the staff, trainees, ladies and gentlemen. It's my honor and privilege to introduce Dr. N. Kalaiselvi, who is going to deliver today's Silver Jubilee Oration of 69th Institute Day. She is the first woman to hold the prestigious position of DG CSIR and the Secretary-DSIR. She obtained her bachelor's and master's degree in chemistry from Govt Art College, which is affiliated to Kamraj University, Madurai, and then she did her PhD at Hon'ble University, Jadhav. Her research work has been more than, say, 25 years, which got focused on the electrochemical power systems and in particular development of electrode materials, custom designed synthesis model methods, optimization of reaction parameters, and electrochemical evaluation of in-house prepared electrode materials for their sustainability in energy storage device assembly. So she has been primarily focusing in the physics area, which I think many of us might not even understand. But apart from this, she has been involved into extensively into extramural research, collaborative research, and sponsored research, which is funded by the DST, CSIR, and MNR. She has also served as a nodal scientist for multi-FUN, which is multifunctional electrodes and electrolytes for futuristic technologies. She was involved in the development of practically viable sodium ion and lithium sulfur batteries and superconductors, and continued her research in these fields. She was the theme director of energy and energy devices of CSIR. She has extensively worked over this period of her career and has produced high quality, more than 135 research papers, 6 patients and has guided numerous research scholars, and the PhD candidates. Even now, she is guiding one PhD candidate when she is so extensively busy with the administrative work. She is a recipient of many prestigious awards, including CSIR Raman Research Fellowship, Brain Pool Fellowship of Korea, the Most Inspiring Women Scientist Award, and there are several others. This list is very long. The CV was several pages, so I had to condense it into maybe about a page now. She has been awarded honorary doctorate degree by the MIT University, Noida. And today she will be delivering the Golden Jubilee Oration of the Institute, which is 69th, on CSIR AIIMS collaboration for affordable healthcare. So I welcome Madam for the oration and thank her for joining the Institute Day. Thank you.
Namaskar, Vanakkam, and pleasant morning to each and every one of you. I'm extremely happy to join the 69th celebration, Foundation Day celebrations of the great institution of the country, AIIMS. Once upon a time, I was thinking that where only this AIIMS is, because I'm just coming from the extreme south and I never had the opportunity to even visit AIIMS. And AIIMS is the name I have studied, I have heard about, I have seen the picture, and that much was my knowledge. But after, when I just landed up in Delhi, then I thought that, oh, AIIMS is also in a reachable distance. And even the faculties are also at a reachable distance. And more importantly, the director is a person who is really, I never made any attempts to reach out to AIIMS, but the director himself came and knocked the doors of CSIR. And I would say without any hesitation, in the history of CSIR, never it was the response from the other end who came and knocked the doors of CSIR for collaboration. Big salute to you, Srinivas ji, because it was you. He not came as an old man army, he came with a big battalion. He came with around 12 great professors. And I was thinking, what is it that AIIMS people will have this much time to devote to research? Then I realized, apart from attending patients, apart from understanding their problems in real time, I really admired the way you people are showing interest towards research, meaning is you should understand the basics. And from time to time, evolving challenges in terms of disease burden, time to time, evolving changes that is required in the field of medicine, wherein you require some kind of an assistance and a help and a support that is required from other areas like physics, chemistry, biology, biochemistry, biotechnology, nanomaterial, material science, engineering and whatnot. Because now we are living in one particular era wherein I cannot say that I know only organic chemistry. Truly speaking, my PhD is in pure organic chemistry. No longer I can say I am organic because I completely forgot my organic chemistry to this. After I got my organic PhD degree, I moved to Central Electrochemical Research Institute, where in 25 years I lived with electrochemistry. Therefore, now I introduce myself. I'm an organic chemist by education and an electrochemist by training. But so why I'm telling is, no, proudly I can say I'm an electrochemist because electrochemistry is an interdisciplinary area which involves whatever subjects I already told, physics, chemistry, maths, biochemistry, nanomaterial, whatever subjects are there under the sun and on the earth, everything could be just put together in one basket and I will call it as electrochemistry. And it is more of engineering, but I am not at all an engineering graduate, but I handled engineering subject. And now after I became the Director General, now I am trying to understand and I'm managing even medical sciences also. I'm not handling. I'm trying to manage the medical sciences related because I try to understand, because throughout the life it is only a learning process, which I need not tell you because all of you are the great examples. And therefore, friends, I'm more than excited to join you. I'm not worried about the oration and all, but I'm more than excited because this is one great galaxy of great talent pool and you are willing to listen to the leadership from CSIR. So just because I happen to be the leadership of CSIR today, you are listening to Kalaiselvi, otherwise you will be listening to the other leadership. Therefore, this is the way AIIMS is honoring CSIR, and I'm truly indebted to the kind of the respect and the recognition that AIIMS is giving and the belief and the trust that you have on CSIR and the scientific research. I think with these few words, you need not worry about it. You know, you said Kalaimani, that is the very right way, because without even knowing that I was born on the first day of Saraswati Puja. So Saraswati, the name is Kalaivani only. My parents put it as Kalaiselvi because they are so much ardent devotees of Tamil language. Therefore, instead of Vani, they put it as Selvi, but it is one and the same. Kalaiselvi is not equivalent. It is perfectly equal to Kalaivani. No need to worry about it. I am so happy. So coming to today's talk, if you give me some collar mic, I can walk and talk. Otherwise, no problem. No problem. So today I'm just trying my level best. I'm not a subject expert. Disclaimer: I do not know subject to the extent that you people know. So I really prepared the slides by understanding something. I borrowed something. I learned something. I tried my level best to understand, and whatever is coming from the bottom of my heart, I'm just sharing here. So my only aim is, country has to really come up with some kind of a development. All of us are definitely working for only one country, and our target is the same target. And the country has already, the national leadership has boldly announced that 2047, India is going to be the developed country. So when the national leadership is making this kind of an announcement, it is not going to be possible by only one person. That one leader is considering, he is believing, he is trusting, and he is of the opinion that the entire population of the country will also think in the same direction, and the country is going to be the developed country in 2047. Therefore, to call ourselves as a developed nation, what are the various areas in which we are supposed to concentrate? So we from CSIR, we are concentrating in different facets of science and technology, and you people are the masters in the field of medical sciences. Therefore, if at all this merger happens, because we from scientific department, we can only come up to a TRL level of 3 or 4 or 5 at the max technology. And if at all it comes to the case of the molecule development before the clinical trial, up to even the first level of clinical trial only, we will be able to manage at the laboratory. And therefore, for our second level of clinical trial, third level, so second phase and the third phase of clinical trial, definitely we require support from the medical fraternity. And therefore, if both of us handshake and handhold, I think this is where we can address the end-to-end requirements of the country, and that is why I am here. I am coming here with a kind of a request. I am placing it as an open appeal. CSIR is open for any kind of collaboration, any kind of discussion, any kind of working together, planning together, thinking together, and also achieving together. We are ready for that. And because I was a strong believer, the moment we start thinking, we start believing, when we come out of our silos, when we say that, when we are able to accept an interface is not an interfering phase, it is the active phase in which many collaborations are finding their success. So we have to find an interface. The interface is nothing but science and technology, in my opinion. Therefore, I'm here, I'm just showcasing you, because if I start talking only like this, then you will be thinking that Kalaiselvi is talking too much. Therefore, I just want to showcase that these are the capabilities, few of the capabilities that we have. Then you will be forced to believe that, yeah, something is going on in CSIR. I can really think very strongly about my collaboration. So just to be know where your confidence, I'll just spend another 20 minutes in sharing 20 slides, and I will try my level best to say that what is it that I look forward. So if you just take CSIR, it's a big family, 10,000 plus employees and 37 national laboratories in 25 different states of the country. And we have all possible areas of science and technology under our umbrella. Only 2 areas are left out. Meaning is, every area we have a dedicated research institute, but for veterinary science we do not have a dedicated institute, but in another institute called CCMB, that is Cellular and Molecular Biology in Hyderabad, we have one center which is called LACONS. So we have even endangered species related research also that is going on in that. Another area which is a gray area to, meaning is it won't be a gray area, I would say. We do not have a dedicated laboratory for that area, is textiles. But we have a huge laboratory, 2-3 laboratories. One particular laboratory is Leather Research Institute. They are considering these textiles also as a part of their research. So rest all areas are there. Today we are going to talk about what are the multiple institutes which are having varied strengths in the field of medical science and technology. So we can talk about CCMB, it is in Hyderabad. So I have given the areas also. IGAB is in Delhi, IICB is in Kolkata, CDRA is in Lucknow, IICT is in Hyderabad. IIMTech is in Chandigarh, IIIM is in Jammu, NCL is in Pune. So wherever you go, whenever you travel, I'm just making it as an open invitation to each and every one of you. Whenever you happen to travel to different parts of the country, almost in every state, there will be a minimum of 1 or 2 CSIR laboratories. Please take the privilege of go inside the laboratory, visit the laboratory, talk to the people, touch, feel, experience, experiment, and then you come up with a kind of an idea whether it is worth going to the lab one more time or not. So I'm just making it as an open invitation. Please use that particular opportunity. So now coming to this one, why should I, as a common citizen, today I'm not standing here as the DG of CSIR, not as the Secretary of DSIR. I'm just standing here as a common citizen of the country. In my opinion, affordable health care is the need of the hour as far as a common man's mind voice says. So I'm here to reflect the mind voice of a common man. Therefore, if at all you just want to understand what is the overview of the Indian healthcare system. So left hand side, I have given countries in their global rank and how much money that they are spending as far as their health is concerned. So India is India's rank is 145. Friends, this number is really pinching here. It is a pain point here. We are talking about India should be the global leader in science and technology. India should be the medical hub. And India should be the developed country in 2047. And it should be a $1 trillion economy. But we are now having only the 145th rank. And the right hand side is much more painful. In India, total public health facilities are more than 2 lakh. And among the 2 lakh public health facilities, I'm just taking data only from the open source. So number of health facilities which are assessed, that is only 40,000. And in this 40,000, the assessed health facility scorecard, if you see, greater than 80% is obtained only by 8,000 and odd facilities only. Therefore, even though we have 2,000 public health facilities, only 8,000 are having more than 80% in the scorecard. Therefore, this number really gives kind of a botheration. And similarly, I just ask you to go through the left-hand side again. Potential requirements, if at all the common man's expectation is affordable healthcare, if it is to be fulfilled, if it is to be satisfied from end-to-end requirements, I'm of the opinion that these are the 8 points which are to be taken into consideration. First one is universal health coverage, public health investment, affordable medicine. So affordable healthcare means definitely affordable medicine, health education and awareness. I think this is the most important thing. Awareness is very, very important. Insurance reforms that Government of India will take care of. Telemedicine and digital health, AIIMS should only take care of. Quality care and infrastructure, both of us can really take care of. Qualified healthcare professionals, definitely it pertains to your area. And of course, to whichever possible way by means of which it could be supported, we are there. Because IGIB, many a times I used to wonder whether it is a CSIR laboratory or it is the extension center of AIIMS. Because many of your doctors are sitting there and many of my scientists are, if at all a scientist is not found on the seat, the standard answer that I used to get is, he has gone to AIIMS for his project discussion. It is true only. So it is this way, it is this particular model by means of which CSIR and AIIMS should start working with each other. So right hand side I have given where are we, where I am just telling these are the requirements. After we understand that these are the potential requirements, if we just take a small lens and find out where are we, actually the current situation is shortage of healthcare professionals. I think you may agree upon. So we can, how to come up with all the, I would say, remedial measures, that also we need to think about. Mixed healthcare system, that is one point. Government initiatives are more, many initiatives are there, but the second point is challenges in implementation. For such a big country like India, many good announcements and schemes Government of India is coming up with. But to what extent we are totally successful in implementing all these points is a questionable question. And therefore, can we do something towards this direction? All of us should really touch our conscience and we have to think about it. And focus on preventive care, definitely, I require your support. I do not know in which form you and me may be able to give this kind of an awareness. I think preventive care is very, very essential. Prevention is better than cure. It is known. Many a times we think it is only a proverb. No, it is to be followed in letter and spirit. To what extent every common citizen is aware of it. Once upon a time, we thought that food as medicine. Now medicine is going as food. Medicine as food is becoming the lifestyle. Therefore, to what extent we are able to come up with a kind of a creation of awareness is a questionable question. Then how high out-of-pocket expenses. India is going to be the developed country. As on date, India is not the richest country. The common man cannot afford to pay lakhs and lakhs from his own pocket, and therefore how best we can make it affordable is a question today. And rural versus urban disparities. Yes, even though we talk about number of mobile centers, telemedicines, number of avenues and implementations are there, but still there is a disparity between the city and the other places. So this is, to the best of my knowledge is concerned, I had some kind of a discussion. Actually, I attended a kind of a teaching learning process before I came here, because I wanted to understand few points very strongly in my mind. That time I just threw this question and asked my research fraternity, what are the diseases to be targeted? So they just gave me this kind of a list: endemic diseases in India. So something is due to virus, something is due to tapeworm, something is even due to venom and bacteria and mites also. So left hand side I have given the endemic diseases in India which are considered from the researcher's point of view. So this is not from the common man's point of view, this is from the researcher's point of view. These are the diseases to be targeted. But right hand side is again an eye-opening point. So it clearly says how many deaths per year is happening with respect to the diseases, and also how much is the money that is being spent for the treatment. So in that case, I think the death is more due to cardiovascular diseases, and the expensive treatment is for lungs diseases. For lungs and liver, the expenses are found to be much more, because it is 20 and 18 lakhs. So this is what the statistics says. And therefore lungs, I think by standing in Delhi, I do not know to what extent I will be able to talk about lungs and all. Very recently, maybe some 3-4 months back, I just read one particular article wherein it was told that red lungs of Delhi, that was the article which I read. I do not know to what extent we will be able to talk about lungs and its improved characteristics. I don't know. We have to really think about it. But I can take one particular challenge, the air pollution, or even suspended particle, or it is a smog related problem. I think all these factors have been prioritized not only by CSIR but also by the Government of India. The government is going to come up with one kind of a new mission called carbon capture, utilization and storage, wherein this carbon capture is going to be prioritized in the coming days and the coming months and the coming years also. And this is a big mission project which is going to be completely handled by Ministry of Power, and the complete R&D is going to be led by CSIR according to the recent meeting and the decisions that were taken at the Prime Minister's office. Therefore, from scientific side, we'll try our level best to make sure that the air pollution and the air quality in Delhi, please don't ask me one question, ma'am, when will you be able to ensure that the air pollution and the air quality is going to be better in Delhi in the coming times? I think I cannot give you the time as on now, but we have really prioritized it. And we will put in our definitely heart and soul in this particular effort, and we will try to come up with some kind of an improving as well as remedial measures in the coming times. So if you just take the disease burden, I asked my people, can you just give me region-wise, gender-wise and age-wise? But they said that, ma'am, these are the important diseases which the country needs to now focus. One is non-communicable disease, and 3-4 diseases they have given, because they are working in these areas and therefore they are thinking that these are the important things. But I'm asking you, please make CSIR to understand, apart from the list that is given, because this slides could be circulated among all the heads also. Please put in your time and energy and also your inputs, and come back and tell me that, Kalaiselvi, you should understand that apart from this list, these are the areas which are to be prioritized from the R&D. Then I will definitely throw it as a challenge internally in CSIR. Therefore, CSIR can really work with AIIMS, and both of us can really make them as a prioritized areas from the year 2025. So that is one of my plans, and definitely I will go with my words. So Srinivas ji, please help me to get a list. I will definitely follow that particular list which is going to be shared by AIIMS. So infectious disease, then maternal and child health, mental health. Friends, when I read the word mental health, I'm really feeling so very bored. Once upon a time, India, we never bothered about the mental health. I think we had a big family. I think the family setup itself was taking care of the entire thing. actually certain words were not at all, we were not comfortable using such words like psychiatrist. Yeah. Do you think that I need it? I don't require anyway. Okay. So psychiatrist and all, what? Oof. Once upon a time, no, psychiatrist and all, no, we thought that it is a term which is not at all required. Which is not at all required, and our Indian families and the Indian citizens, we never required that kind of a thing. Because there was a grandfather, there was a grandmother, they both took care of all our problems, whether it is physical or mental, and never we thought that there is one more doctor who is required for family. Nowadays only we started talking family doctor. Once upon a time, we were thinking only family members. Now we started thinking about family doctors, and slowly we will be forced to think about family psychiatrist also. Because the psychiatrist will know all the family problems in a much more details rather than the family members, and he or she may be in a position to give the proper advice also. I think this is not a good sign at all. Mental health should not be a problem for a country like India, because the country has that kind of a family value. The country has already taught life values, and therefore we are now moving away from many of our culture, and we are going far away from the tradition, due to which now we are forced to think about this mental health. Otherwise, mental health, this word or this particular bullet should not have taken place in this slide. This is what I feel. Okay, no problem. Oh God, what happened? Huh. So, reproductive health, kidney and liver diseases, that is fine. But mental health, I think you and me, we have to take one more special exercise. I already offline, I had discussion with your Srinivas ji. So we are thinking that, can we do something to the society by means of which even the youngsters and different age group could be taught the basic values, the basic and the cultural values of the country, cultural value of the family values in life. And I think health-related tips also could be embedded, by means of which we should try to avoid. Maybe after 2 years or 5 years, or at least after 10 years, somebody who is standing here and giving the oration should be able to say that mental health has been erased from the list. If that happens, I think that is the success of AIIMS and CSIR collaboration. And current Indian perspectives, if you see, no, but as from the R&D side, if at all you ask me, what is it that you can do with this? We can try to help you in 3 different, I would say, parameters or 3 different directions. One is surveillance. Definitely we can help you, because during COVID time, many of our laboratories, actually CCMB, NEERI, NCL, IICT, many laboratories, we all formed a cluster, and Maharashtra cluster, the Nagpur cluster, Hyderabad cluster, Kerala cluster, Tamil Nadu cluster. Like that we formed the cluster, and from wastewater, we collected wastewater, and from the wastewater they were able to identify, I would say, the severity of the problem, and also to what extent it is going to spread in the coming days also. So surveillance, we were able to be very, very successful. Professor V.K. Paul used to take meetings, and every day in CSIR evening 3 o'clock we'll sit, and up to 9:30 night we used to discuss exclusively. 142 meetings happened during that particular time, and the complete details are documented. Because of that, we also got some small award, Golden Peacock Award and all, but I'm not worried about the award, but we were able to contribute very, very timely. We worked so closely with ICMR also, and with very many associations, by means of which we were able to come out with some kind of a very useful and significant potential contributions that time. Then drug development, of course, definitely we have one particular laboratory, dedicated laboratory, Central Drug Research Institute, Lucknow. So this lab is very, very particularly focusing its attention towards the development of new drugs. And we have few other laboratories who are working on phytopharma related drugs also. Main thing is AIIMS Jammu. AIIMS Jammu, we are coming up with number of success stories. I'll show you in the upcoming slides. Genome sequencing and editing, it is, we can lift our collar up and say that at least we have one great institute in Delhi, which is IGIB. I normally tell the director, you should make your institute so popular in such a manner. The Delhi airport is IGIA, Indira Gandhi International Airport. So anybody who is coming to Delhi next to IGIA, they should have tendency to go to IGIB. So to what extent people are aware of, even the educated people, educated community, how many researchers, how many scientists, how many officials, how many of them are already aware of the fact that IGIB is in Delhi, and IGIB is working in very specific areas of genome sequencing, genome editing. So to what extent you made yourself available and popular and made known to the common citizen? Again, I told the director that he has to come up with a number of new ideas, and you may also definitely try to help. It is not for popularity, it is to create awareness. And already AIIMS, this IJB is a very popular institute, therefore I need not talk about IJB. So National One Health Mission, why am I showing here is CSIR is also finding a place here. So the country has identified every important R&D organization in this particular endeavor, and we are the proud partners of Mission One Health. So in One Health Mission, actually within CSIR, I just redefined it. For country and for the project proposal, we have submitted something the team is working towards. But within CSIR, there is One Health Mission. There I said, apart from human health, you have to think about animal health, plant health, soil health, and later on I added even data health also. So you put in all these things under this One Health, because data health is becoming very essential. Safety, security, because Kalaiselvi standing here is a data, Kalaiselvi giving oration is a data, Kalaiselvi living itself is a data, how many times I am breathing is a data. So I am nothing but I am not a human being, I am a huge package of data. So I am being now defined by only two things, my mobile number, meaning is I am getting defined as by a numericals, 948696510. I already revealed my mobile number. So this is what Kalaiselvi's identity is. This is number one. What is the second usage of Kalaiselvi? She will be definitely generating number of data. So even if I don't do anything throughout my lifetime, indirectly I am doing some service to some corporate sector or some company, because I am the source of data to many people. But to what extent this data is being handled and managed and it is utilized very safely, very perfectly, ethically is a question, and therefore, is it not our responsibility to give that kind of an awareness to the youngsters and also to old people also? Very casually, we just download everything from the Play Store without even knowing that we are giving permission for A, B, C, D. Cookies is the most difficult thing. Eating cookies is one thing. The other cookies is eating away all our privacy without knowing that we are allowing cookies. Without allowing cookies, you cannot even move one step, but that cookies start eating your entire life, because you are everything, whatever you are talking. The moment you switch on the mic, whatever you are talking, nobody is needed to know what you are thinking. The mobile phone is the biggest enemy. Therefore, this data health is also to be brought under this One Health. Therefore, in CSIR, I was able to just make that particular point very strong. Now, coming to AIIMS perspective, affordable healthcare. I think in AIIMS, I should not say AIIMS perspective should be like this, but what I feel, whatever I felt like sharing, I have given here. Universal access to healthcare. Actually, you can, whichever way you can strengthen, please note down only the points. I can see many of you have taken the photograph. Cost-effective solutions. What could be done? You can only come up with. Preventive healthcare, I already told, prevention is better than cure, should be given in quotation. Integration of service. I think this integration is the most difficult word in this, I think in the present time. Everybody, we are thinking that, yeah, I'm great, I'm doing good science, I'm doing impeccable service. Okay, fine. The one who is next to me is also doing the same thing or much more than the way I'm doing it. And therefore, what is the problem that they're going and shaking hands and just working together? In synergy is not at all going to happen unless otherwise we integrate. So please let us prioritize the word integration. So we have many silos, many verticals, but we need one horizontal, one umbilical cord relationship, one umbilical cord connectivity, which is called integration. So integration is like the umbilical cord that will integrate all our interests together, and therefore we will be able to come up with the cumulative and consolidated efforts. So telemedicine, public-private partnership. I think public-private partnership, you can also think very seriously. I can also think about it. And the last one is very, very important, patient-centered care. I think that point you can prioritize. From CSIR, I'm just promising here that we will be just dedicating our research towards this direction. Innovation in drug development, development of diagnostic tools. Yes, exactly, we are coming up with. We are trying our level best to make even Raman spectrometer, even NMR, even IR. To what extent we can make all these analytical instruments also to be used for the preliminary screening and in many cases, non-destructive analysis also. Then biotechnology for healthcare, research in preventive health, public health initiatives, we are also doing to some extent in the way which is known to us, we are also doing some public health initiatives. Technology translation, of course, we are working with many companies, sometimes big companies, sometimes small companies, and even I cannot use the word startup in this case, but number of incubation centers also we are able to push few of our technologies, and we are trying our level best in different directions. Sustainable healthcare practices, exactly, we are giving lot of importance to that. And starting from food, because we are having one dedicated institute which is called CFTRI, Central Food Technology Research Institute in Mysuru, and also we have NIST Trivandrum. So the person who did his who spent his lifetime in CFTRI is the director of now NIST Trivandrum. They are also working food related things, and 2 other laboratories are also working to what extent food and nutrition value of this particular time, the community of this particular time could be really taken care of. So there we are talking about sustainable health tips also. And when the country celebrated this year of millet, we also came up with the launch of Millet Mission. Millet Mission was very successful. Even last week we had some kind of a food festival and food exhibition, and many of our scientists were there. And we have gone to the extent that we are coming up with a number of patents, and even artificial digestive system, lungs and respiratory system is completely mimicked in one of the research attempts, for which one of our directors also got some kind of a very, very valuable prize. Vigyan Shri also he was awarded with. And the last one is collaborative research efforts, for which I'm really standing here. Now, envisaged collaboration, the first and foremost thing is personalized medicine revolution, because especially IGAB and the other teams, they are coming up with the 4P concept. What they say is it should be predictive, it should be very perfect, it should be very precision based, and it should be extremely personalized also. They call it as a 4P category, 4P concept. They are working on it, and whenever we introduce any kind of a cohort study also, they always prioritize this kind of a personalized medicine revolution. And CSIR, along with not only this IGAB, with IICT, NCL, IIIM Jammu, CDRI, IMTech, and CCMB, we are all of the opinion that we have to prioritize nanomedicine. If at all it is agreeable to you, nanomedicine could be one of the areas wherein AIIMS and CSIR can think about. So far I was going on telling that you can think about, I can think about. Now you can ask me, what is it that you have already done? So I can say that these many missions are going on in CSIR. Left hand side you can see healthcare team. In CSIR I told you 37 national laboratories. So it is very easy to monitor all the 37 laboratories if at all they are categorized under themes. So we call it as thematic labs. So we have 8 themes. Among the 8 themes, one theme is healthcare theme. So these are the prioritized areas under healthcare theme. So precision health, drug discovery, phytopharmaceutical, new biology and interface, and healthcare devices. Yes, we are working on medical devices also, and molecular diagnostics, digital health and diagnostics, and microbes and health also. And for especially AMR, now I think AMR is becoming the buzzword slowly. And even Royal Society UK, the person is very, very intensively, closely working with CSIR. And maybe soon we may be able to come up with a kind of a center of excellence which is going to be common between UK and India. Maybe in CSIR premises, this is the way with the dialogues are ongoing. So AMR, we want to take R&D lead, and whichever way you can also join hands and strengthen our efforts, please make that to happen. So already we have pan-CSIR cancer mission, we have antiviral mission, we have neuroscience mission, we have AMR mission. AMR mission is going to be completely strengthened, because earlier AMR related works were taken in the form of a fast-track translation projects. Now I'm just making it as a mission. From 1/4/2025, it is going to be a big mission activity in CSIR. Then phytopharmaceutical mission is already ongoing. Phytopharma, we are coming up with number of success stories. I do not know how many of you are aware. CSIR is famous for 2 important missions. One is aroma mission, the other one is floriculture mission. Aroma mission is the purple revolution, lavender revolution that we have already done. We have carried out number of essential oils extraction, and number of entrepreneurs are there in Jammu, Kashmir, Bhadarwa and other places, Leh, Ladakh area also. And in the case of floriculture, it is again another very successful successful mission, that gave us a lot of popularity. So that is being governed by the Lucknow-based labs. We have Botanical Research Laboratory, NBRA Lucknow. We have Medicinal and Aromatic Plants Research Laboratory, which is CIMAP in Lucknow. So these are the two laboratories which are having, and you will be very much surprised to know we have one laboratory called IHBT Palampur, which is Himalayan Bioresources Related Laboratory. Just see the visionary ideas, my friends. No, we are talking about, no, I have learned something in chemistry or organic chemistry or electrochemistry, and I'm trying to make it as a plan for 5-year, 10-year roadmap. I'm really breaking my head what and all should be given. But the visionary leaders, several decades back, they thought that for a country like India, even Himalayan bioresources are to be really taken care of. And there is one institute, national institute got established in Palampur, which is IHBT, which is one among the 37 national laboratories of CSIR. So these laboratories are really concentrating in this phytopharmaceutical mission, and we have number of technology leads and success stories, and the API mission is there. Sickle cell anemia, again, it is a very, very, very close to heart mission, I would say, because the country already decided that 1 crore screening has to be done. That was the target. Even finance minister also during the budget time also, Madam Nirmala Sitharamanji, she was making a mention about this sickle cell anemia, and some amount of fund also has been dedicated. But before even the country started thinking about the budget, whether it was the last year budget or this year budget, we started this particular mission 7 years back. And this sickle cell anemia mission is one of the successful missions, I would say. There is one dedicated doctor, his name is Chandak, and Chandak is living in Hyderabad, and he is really traveling across different places. And the way he is giving awareness, the way he is working with primary health center, the way he is working with hospitals, the way he is working with the villages, door to door they go. He is going along with the set of research scholars, many research scholars from CCMB Hyderabad. They are doing research in the sickle cell anemia, and sickle cell anemia has given us really lot of popularity and visibility among the common man. So they started even doing counseling also, to what extent marriages can be avoided with that kind of a people, because it is very popular among one particular belt, and we have now come up with a kind of a map of this sickle cell anemia where it is really very much serious, and we are able to even give counseling also to youngsters. And IND mission is another one. So this is one APIs for AHC, because when I'm talking about affordable healthcare, you should not think that CSIR is yet to think about. No, already we have number of mission projects which are ongoing. So one such project I have given here, CSIR IICT is leading. So you can really understand, not appreciate, you can understand that what is the way by means of which our mission projects are getting priority. 19 APIs and KSMs we have already identified, and they have been prioritized. This mission is all about these 19. I have given what are those 19 and who are the laboratories and who will do what is also given here. This is how the responsibility is already distributed among different laboratories. And for next 3 years, because already we started it 2 years back, and we will get it continued for another 3 to 4 years. And these are the 3 work packages. One is viable synthetic processes for all the 19 APIs and KSMs. I'm really hopeful from the 19, at least if 5 or 6 are going to give us success, I think we are ready to celebrate the phase 1 success, and with that kind of an encouragement we will move towards phase 2. Then patent search, white space, there is one particular unit called Urdip, which is there in Pune. I just made that particular team to completely dedicate their time for this particular mission, because now they are coming up with a kind of a white space analysis, and they will be coming up with the FTO, then Indian patent, then they will come up with the kind of commercialization also. Last one is the environmental sustainability analysis. Of course, we have NEERI and other laboratories. They will take care of that particular point. So you can just ask me, can you just give us some glimpse of your success stories? These are the success stories. So maybe Covaxin, I think all of you may be aware of. It is the very important ingredient of this Covaxin. It is a contribution of IICT. I do not know to what extent I can say that. Once upon a time I used to say, if at all you have taken Covaxin, already you are living with CSIR, because a portion of CSIR's technology is already there within yourself. So this is how our ideas and our technologies and our developments are reaching the community. We are closely working with different companies. I have given some examples here, whether it is Sami Labs or Satyadeepa Pharmaceuticals or Godrej Industries. We are working especially on Favipiravir and Remdesivir. I think that also is a very, very important area. And this is one particular area I think Srinivas ji is totally aware of. Now we are coming up with not only the drug development, because we are talking about environment impact also. And therefore, all the medical wastage, biomedical waste, how are we going to handle? I was told that when a patient is getting admitted as an inpatient in the bed, I think along with other charges, some charge, a portion of a small amount is also being included for the waste disposal also. So for even waste disposal, some amount is getting included, means waste disposal needs definitely some very, very important focus and target. And one particular laboratory, NIST Thiruvananthapuram, they have come up with a kind of a very, very game-changing technology solution. And soon we will be coming up with one of the units. It will be installed in the premises of AIIMS. You can feel free to use it, and you can come up with a kind of a data. You can certify whether it is good or bad, or whether it requires some kind of a development, or it is good for nothing. That also you can certify. So it is open for that kind of a certification. So we, from scientific side, we understand that yes, we have come out of a great success, but the success has to be endorsed, and it should be definitely valued and supported by AIIMS. So I'm making it as a request one more time to Srinivas ji. I'm just waiting for the date of our Honorable Minister of Science and Technology. Once the date is given, I think we will be able to come up with, and we will be giving some installation. Maybe 50 kg or 100 kg. If at all 50 kg unit means maybe 10 to 20 minutes is the processing time. Then you will get the complete biomedical waste which is getting converted into a soil additive. That soil additive could be used in your garden, in your landscape itself, because we are using it in our laboratory premises, and we are happy. But I'm just making it as an open challenge to you. Please, you certify and you share your experience also. And coming to the clinical pipeline, this is the CDRI's very important thing. You can see what are the diseases they have taken and what are the targets. So whether it is postmenopausal osteoporosis or pancreatic cancer or fatty liver. I was told this fatty liver, especially non-alcoholic fatty liver disease, is becoming very, very popular these days, and therefore we have been asked to prioritize that particular area also. Therefore CDRI is coming up with. CDRI and AIIM, they are coming up with a number of success stories, because they are at different levels of clinical trial. Similarly, if you just take modern drugs and phytopharmaceutical drugs or Ayush drugs or biologicals, this is the way we have prioritized. So I have given what are the very important components that each laboratory is making, and what is their level at which as on date. So many cases we have completed phase 2 trial, and some cases we are able to push them to phase 3 trial also. So now coming to the last few slides, IGIB, which is known to many of you. So far we were talking about diseases. Now last few slides, I thought that it is worth spending time on disorders. So if you are a material scientist, then this disorder is a boon, because you can definitely spend some time and you can say all these disordered molecules, I can make it as an ordered molecule, or you can say you can make asymmetry itself also to work in the favor of activity. But in human cases, this disorders definitely requires a different kind of an attention. So AIIMS and IGIB, we are working on different kinds of disorders. So the model is like this: patient recruitment is happening, sample collection, then genome sequencing, data mining, then the patient report generation is going. This is the workflow between AIIMS as well as CSIR. So this is a model with which right now we are working, and the main categories and type of diseases are given here. And especially in the coming days also, we are planning to prioritize our collaboration with AIIMS in these particular directions. One is genetic disorder, the other one is neurodegenerative diseases. I think if at all we are able to strengthen our collaboration in these areas in the coming days, I think we may be able to definitely do some justice to the nation. So in my last 2 slides, concluding slides, what is it that we can do together? Because so far I was talking no more silos, should be an integration, should be an interface, should be some synergy. Therefore, together we should ensure public health infrastructure, digital health to be really improved, and a health information system also should be value added. AI and ML, I think many a times in a lighter way, I used to tell my scientists, if at all you want to really do something and really get some award, you should do some work in artificial intelligence, because real is different and artificial. So to get the real award, you should work on artificial intelligence. So artificial intelligence and machine learning is nowadays becoming the need of the hour, because once upon a time when computers got introduced, people were laughing at, they used to say it is a computer designed sari. Then people will say, what is it that, how computer will design a sari? So this is what people, we were once upon a time, number of exclamatory marks were there, but now without computer, without mobile phone, without digital system, we cannot live. And similarly, AI and ML, already we are living with that. But now only we realize that this artificial intelligence and machine learning, we have to be very careful in handling them, managing them, and also use them for the scientific development. Wearable technologies, I need not even tell. I think along with the costume, now many of the people, they are having number of bands. So once I thought that it is only this rainbow is having band and our electrons will be having different valence bands, electron bands, SP, DF and all, but now human beings are also having number of bands. They say one is for pressure band, the other one is for A band, B band, C band, number of bands are there. So to that extent, I do not know whether it is a smart life or lifestyle or it is the fate of human being. I do not know what is the correct word to be utilized. But people now, human beings are now seen with a number of bands. So this wearable electronics is also becoming the need of the hour, and let us concentrate on that also. Then health data analytics, innovative medical devices, and the very important thing is R&D. So whenever you are talking to real human beings and we are talking to only the molecules. So the molecules are going to be given to only the human being. So how the molecules are going to have some kind of a living, I would say, agreement with the human being, I think that is the very important portion wherein both of us should really understand. To have that kind of an understanding, we need academia, industry, hospital collaborations. So this is where we are targeting AIIMS. Training and capacity building, of course, we have to do, we are doing, you will also be doing. I think together we can plan. Srinivas ji, if at all it is agreeable to you, together we can plan some kind of a training courses. From CSIR in Ghaziabad, we have one training center which is known as HRDC Ghaziabad, and it is the highly occupied, I would say, organization. Throughout 365 days, some training or other program will be going on. We are doing it only scientific related thing, then slowly we are going for even business related thing also, then personality development also, scientific business development also we are doing. I think this is high time. If it is agreeable to you and your organization, I am open for that. CSIR and AIIMS can come up with a kind of one combined package, and we can make it as a training package and a module, and that module could be taught from the Ghaziabad Institute, and participants from AIIMS side as well as from CSIR side, and we can make it as an open participation to the country also, and both of us can be the resource persons and we can handle classes and we can give some awareness. Regulatory framework, of course, Government of India will really take care of it, for which the duty of CSIR and AIIMS is just to provide data. So what is the roadmap? So having talked for so many minutes, and taking your very precious and valuable time, because you forgot your patience and your time and you are patiently listening to me. Therefore, these are the points which I feel that the roadmap of affordable healthcare. One is strengthen the primary healthcare infrastructure, expand and improve health insurance coverage, promote generic drugs. I think that is very important, and local manufacturing. We are now talking to Niti Aayog also. Dr. Paul is there, Dr. Saraswati is with us, and we are talking to even PSA and PMO also. To what extent is local manufacturing and generic drugs should be promoted and prioritized. Public-private partnership, we are there. Regulate the healthcare cost, and health education and awareness we have already talked about. So friends, in a nutshell, what is it that I was going on talking, even after just dripping one tumbler of water here also. Many of you did not witness it. Actually, something happened here also. Some remedy was also done by someone. So with this kind of a thing, I wish to conclude your 69th Foundation Day celebrations, having my oration. I wish to conclude it like this. Can both of us collaborate? Can both of us join and work together? And can we have the common target of making India to be the healthcare capital of the world? If both of us say yes, I consider this as the success of my request to you. I don't want you to create oration. because I do not know to what extent I was the correct fit or I am the correct fit. But one thing I'm able to understand, that some kind of an interest is there from the other end also. Let us invest in each other's capabilities, and let us come up with kind of a synergized thing. And our aim is Viksit Bharat. Viksit Bharat should be made in reality only if you and me join together and make India as the healthcare capital. Thank you so very much. Namaskar. Big thanks to Srinivas ji and to the entire team of this. Thank you so very much.
Thank you, ma'am, for that wonderful insight talk in your thoughtful voice. I'm sure it has reached far into the corners of the world. Thank you, ma'am. So I request the dignitaries on the dais, led by the director, to felicitate the orator with the plaque. Education. So you are please welcome to visit the exhibition, which will be inaugurated in a short while by our President, the Minister of Health and Family Welfare, in a short while. All right. Thank you very much. So thank you very much. So you may either stay here, browse through your phones. I'm sure you have a lot of messages that have been waiting for you. And after that, you can please come back here. With the inauguration, we'll have the formal events related to the Institute Day. Thank you very much.
Excuse me. Excuse me, भैया.
Morning. I request you all to come back inside. We are going to start with the formal Institute Day program. And please keep your phones on silent or categorically just switch them off. Thank you very much.
अखिल भारतीय आयुर्विज्ञान संस्थान के 69वें स्थापना दिवस में आप सबका एक बार फिर से स्वागत है। मैं विशिष्ट अतिथि राज्य मंत्री श्री प्रतापराव गणपतराव जाधव जी और अन्य गणमान्य अतिथियों से निवेदन करूंगी कि वह कृपया मंच पर आएं।
Thank you. As a token of appreciation, we would like to present our dignitaries on the stage with a potted plant each. Thank you very much. To begin the sequence of events for the day, I request our Honorable Director, Professor M. Srinivas, to welcome the gathering.
Thank you. Honorable Chief Guest, Shri Nadda ji in absentia, and our guest of honor, Shri Prataprao Ganpatrao Jadhav ji, Honorable Minister of State, Independent Charge for the Ministry of Ayush, MOS, Health and Family Welfare, Government of India. Our acclaimed orator, Dr. N. Kalaiselvi Madam, Secretary-DSIR and the Director General of the CSIR. Past directors of the institution, esteemed colleagues, distinguished alumni, students, staff of AIIMS, and dear friends. It's an honor and privilege to stand by before you today as we celebrate 69th Institute Day of AIIMS New Delhi. This annual occasion not only marks the culmination of the yet another year of remarkable achievements, but also provides us with the opportunity to reflect our legacy and look forward to the future. This year's theme has been innovation in healthcare and medical education. You can see the entire spectrum of the activities which have been put up from each department in the foyer. AIIMS has been a beacon of excellence in healthcare, medical education, and research, not only in India, sir, but across the world. This institute was founded on the principle of providing the highest standard of medical education to the people of India, and over the years, we have consistently raised our bar, creating a model for academic healthcare institutions worldwide. So with respect to the patient care and innovations, we have taken significant strides in advancing the patient care, integrating cutting-edge technology and refining clinical processes. We would like to mention that we cater to more than 5 million, that is 50 lakh outpatients last year, and more than 3 lakh inpatients, and perform more than 3 lakh surgeries. Most of them too complex to be done anywhere else in the country, sir. In line with the theme of this year's exhibition during the Institute Day celebration, we are pleased to say that implementation of AI-driven diagnostics, robotic surgeries, data analytics in predicting and preventing healthcare risks are the prime examples of how AIIMS is at the forefront of transforming healthcare delivery in India. As far as education, sir, we commemorate the special day, and we want to highlight the efforts and success of our academic faculty and the students. AIIMS has been ranked as #1 amongst the medical institutions since inception for ranking. This is the 7th consecutive year, sir. We have remained as #1 in this country in the medical education institutions of the country. Our researchers have been at the forefront of tackling some of the most pressing health issues of our time. And AIIMS has been designated a center of excellence recently in healthcare for AI. Over the last 3 years, AIIMS has been working relentlessly with the ministry in developing, testing, deploying the solutions across the specialties like dermatology, ophthalmology, radiology, and many more departments. And this is definitely going to transform healthcare delivery at the primary care at level for the country, sir. Recently, we have been designated as a lead institution for healthcare by AI in the Ministry of Education, through which AIIMS leads a consortium of 20 organizations across the country, some of the IITs and IIMs and IICs involved in that consortium. As far as collaboration and outreach, sir, we want to acknowledge the valuable partnerships we have established with the global institutions and organizations. We have also collaborated with institutions like Indian Institute of Technologies in India, other AIIMSs of India, All India Institute of Ayurveda, which has been very kind to your heart, THSTI, and other institutions for multidisciplinary research and collaboration, sir. We have been putting a lot of importance to the good governance and transformations in the AIIMS, sir. We would like to have immense pride in announcing that AIIMS New Delhi has solidified its position as a pioneer in surgical excellence and training with all the available robotic systems for training purposes under one roof in AIIMS campus. Recently, AIIMS New Delhi has pioneered various IT initiatives, developing several in-house software solutions to enhance services, some of which will be dedicated to the nation today by the honorable guest today. To further transparency and maintain the trust of patients, in a real-time dashboards have been created and made accessible to the public. And AIIMS has been a forerunner in implementing the Ayushman Bharat Digital Mission, ABDM, overcoming the various challenges and setting an example to the nation, sir. आज के दिन में सर हम इंडिया का #1 है सर. We have created almost 7 lakh ABA IDs and generated more than 20 lakh scan and share, and we got the #1 prize from the National Health Authority on this, sir. We are conscious about the quality also, and we have received NABH certifications for several of our blocks and centers, and we are working towards entire hospital getting the NABH accreditation to keep the quality and the standards, including for the main hospital. Similarly, for the laboratory also, we are getting all the enabled accreditation for all the laboratories, and we are doing this in a phased manner. So as we celebrate our Institute Day, it's a time to look forward for the future. The field of medicine is evolving rapidly, and we will continue to be at the forefront of these changes. We are envisioning a future where AIIMS remains a global leader in healthcare, where we continue to shape policy, set standards, and drive innovation. The coming years will see an expansion of AIIMS into newer territories, enhancing our capacity to serve the nation. Our strength, sir, lies in our ability to adapt to changes times while staying true to our core values of service, compassion, and excellence. With the unwavering commitment of our faculty, staff, and students, we are confident that AIIMS will continue to serve as a lighthouse of hope for millions of people, not just in India, but across the world. Jai Hind.
थैंक यू सर. अब हम उद्घाटन और पुरस्कार वितरण का कार्यक्रम आरंभ करेंगे.
So we have a few inaugurations that we are going to be running through today, and we request our honorable guest of honor to be virtually inaugurating various digital initiatives and the fire station at AIIMS New Delhi. So I will take you through a few.
एम्स नई दिल्ली भारत में स्वास्थ्य सेवा और चिकित्सा शिक्षा का प्रमुख केंद्र है और इसके निरंतर विस्तार, विशाल वर्कफोर्स और फाइनेंशियल ऑपरेशंस को मैनेज करना एक कठिन और चुनौतीपूर्ण कार्य है. इसके पृथक केंद्रों में 15,000 से अधिक कर्मचारियों के लिए ह्यूमन रिसोर्सेज और फाइनेंस को प्रबंधित करने के लिए एक इंटीग्रेटेड और सीमलेस सिस्टम की आवश्यकता कहीं ज्यादा महत्वपूर्ण है. एम्स दिल्ली ने प्रधानमंत्री के डिजिटल इंडिया और नेशनल ई गवर्नेंस प्लान से प्रेरित होकर अपने ह्यूमन रिसोर्स मैनेजमेंट, फाइनेंशियल मैनेजमेंट और प्रोक्योरमेंट रेफरेंसिंग कम ऑडिटिंग सिस्टम को डिजिटाइज करने के लिए सीडैग नोएडा, जो माइटी की वैधानिक संस्था है से हाथ मिलाया। मानव संसाधन और वित्तीय सेवाओं के लिए साहस सिस्टम फॉर एम्स ह्यूमन रिसोर्स एंड अकाउंटिंग सर्विसेज को शुरू किया गया है। ये एक इंटीग्रेटेड प्लेटफॉर्म है जो संस्थान को 24/7 क्लाउड आधारित सुरक्षित समाधान प्रदान करता है। इसके 3 आवश्यक मॉड्यूल हैं। EHRMS, जिसके विभिन्न अंग हैं ई-सर्विस रिकॉर्ड्स, ट्रांसफर एंड पोस्टिंग, इंक्रीमेंट एंड पे फिक्सेशन, DPC एंड प्रमोशंस, लीव मैनेजमेंट, एनुअल परफॉर्मेंस अप्रेजल मैनेजमेंट, अटेंडेंस मैनेजमेंट, प्रोक्योरमेंट डिजिटल लाइब्रेरी PDL, जिसमें प्राइस रेफरेंसिंग, रेट रीजनेबिलिटी, प्राइस एस्टिमेशन, रेट कॉन्ट्रैक्ट मैनेजमेंट, इंटरनल ऑडिटिंग, प्रिवेंटिव विजिलेंस और ट्रेंड एनालिसिस का प्रावधान है। फाइनेंशियल मैनेजमेंट सिस्टम, जिसमें बजट एलोकेशन, सैलरी डिसबर्समेंट, पेंशन मैनेजमेंट, IT असेसमेंट, अरियर पेमेंट्स, बिल रीइंबर्समेंट, बजट फोरकास्टिंग का प्रावधान है। साहस के माध्यम से ह्यूमन रिसोर्स मैनेजमेंट, फाइनेंशियल मैनेजमेंट एंड प्रोक्योरमेंट मैनेजमेंट जैसे जरूरी कामों को जोड़ते हुए पहली बार एक एकीकृत प्लेटफॉर्म की नींव रखी है। साहस का हाइब्रिड डेटा आर्किटेक्चर डेटा को सुरक्षित और तेजी से एक्सेस करने में मदद करता है, जिससे संचालन काफी आसान हो रहा है। इसके साथ एम्स दिल्ली में ह्यूमन रिसोर्सेज के डिजिटलीकरण का विस्तार हो रहा है। एम्स के कर्मचारी अपनी सैलरी स्लिप्स, छुट्टी की जानकारी अब कभी भी ऑनलाइन देख सकते हैं। साहस के माध्यम से कर्मचारियों को ऑनलाइन छुट्टियों के आवेदन और एनुअल परफॉर्मेंस अप्रेजल की सुविधा मिलेगी। साहस में एक कॉम्प्रिहेंसिव डिजिटल डैशबोर्ड भी है जो फाइनेंशियल और ह्यूमन रिसोर्सेज की स्थिति की निगरानी करता है, और इससे पेपर के उपयोग में कमी आ रही है, जिससे कार्बन फुटप्रिंट को कम करते हुए हर महीने लगभग 2 पेड़ बचाए जा रहे हैं। प्रोक्योरमेंट डिजिटल लाइब्रेरी खरीदारी और इंजीनियरिंग प्रक्रिया के लिए अभूतपूर्व पारदर्शिता लाने वाला एक प्रभावशाली समाधान है, जो कीमत और मूल्य को तर्कसंगत, संदर्भित और निर्धारण में मदद करता है, और इस सुविधा के तहत हर कोई आसानी से खरीदारी का पूरा विवरण देख सकता है। और भविष्य में आर्टिफिशियल इंटेलिजेंस और मशीन लर्निंग के उपयोग से रियल टाइम ऑडिटिंग और व्यापक जांच में चीजों की खरीदारी की सुविधा प्रदान करेगा। साहस सिर्फ एक सिस्टम नहीं है, ये एम्स के भविष्य के लिए एक विजन है, जहां तकनीक और दक्षता मिलकर काम करेंगे और डिजिटल इंडिया को मजबूती प्रदान करेंगे। ये प्रणाली सुनिश्चित करेगा कि भारत का प्रमुख चिकित्सा संस्थान आने वाले वर्षों तक उत्कृष्टता का प्रतीक बना रहे। एम्स नई दिल्ली को निरंतर NIRF रैंकिंग में प्रथम स्थान मिल रहा है। साहस के माध्यम से संस्थागत मानव शक्ति, प्रशासनिक और वित्तीय सुधारों, पारदर्शिता, अच्छे शासन और प्रशासनिक दक्षता में भी एम्स नई दिल्ली प्रथम बनने के लिए वचनबद्ध है।
So there is another video on a new system for patient feedback and grievance redressal system, which is called Santusht.
आपकी संतुष्टि ही एम्स की सबसे बड़ी उपलब्धि है, और आपकी इसी संतुष्टि को बनाए रखने के लिए एम्स टीम ने की एक ऐसी जनहितकारी पहल जिससे मिल सके रोगियों को, परिजनों को एम्स से जुड़ी शिकायतों का सर्वसुलभ समाधान। एम्स का नया वेब पोर्टल संतुष्ट। जी हाँ, भारत सरकार की डिजिटल भारत की मुहिम को ही आगे बढ़ाते हुए एम्स दिल्ली ने शुरू किया अपना नया वेब पोर्टल संतुष्ट। वेब पोर्टल संतुष्ट पर लॉगिन करके एम्स में इलाज के लिए आया कोई भी रोगी या परिजन एम्स परिसर से जुड़ी किसी भी तरह की शिकायत या परेशानी को एम्स टीम तक आसानी से पहुंचा सकता है और अपनी समस्या का उपयुक्त समाधान एम्स टीम द्वारा पा सकता है।
मरीजों की देखभाल एवं उचित सेवाएं प्रदान करना हमारी प्राथमिकता है। हमारा लक्ष्य है कि हर व्यक्ति को वह समर्थन और साथ मिले जिसकी उसे अपेक्षा है, और इसके लिए हमारा संतुष्ट पोर्टल आपकी सेवा में सदैव तत्पर है।
प्रिय परिजनों एवं इलाज के लिए आए रोगियों, अगर आपको एम्स की किसी भी सुविधा, सेवा, व्यवस्था, विभाग, व्यवहार या कार्य प्रणाली से किसी तरह की परेशानी का सामना करना पड़ा है, या एम्स में इलाज के दौरान रोगी को हुए अनुभव को लेकर आपका कोई फीडबैक या सुझाव है, तो अब एम्स से जुड़े अपने अनुभव, परेशानी, सुझाव या शिकायत को अपने मन में मत रखिए। एम्स के नए वेब पोर्टल संतुष्ट पर तुरंत लॉगिन कीजिए और अपनी शिकायत या अपने सुझाव लिखकर एम्स टीम को भेजिए। संतुष्ट पोर्टल पर आप शिकायत या सुझाव से संबंधित फोटो या वीडियो भी अपलोड कर सकते हैं। शिकायत दर्ज करने या सुझाव भेजने के लिए बताए गए चरण अपनाएं।
सबसे पहले कोई भी वेब ब्राउजर खोलें। प्राथमिकता गूगल क्रोम को दें। अब गूगल में एम्स संतुष्ट सर्च करें। अब सुझाए गए लिंक में सर्वप्रथम लिंक संतुष्ट एम्स दिल्ली पर क्लिक करें। आप अपनी शिकायत परिसर में विभिन्न स्थानों पर प्रदर्शित क्यूआर कोड को स्कैन करके भी सीधे संतुष्ट पोर्टल पर दर्ज करवा सकते हैं। अगर आप एम्स संतुष्ट पोर्टल के नए यूजर हैं तो रजिस्ट्रेशन टैब पर जाकर अपनी यूएचआईडी के द्वारा खुद को रजिस्टर करें। रजिस्ट्रेशन स्टेप्स, शिकायत सबमिट करें विकल्प पर जाएं। इस पर क्लिक करने पर एक फॉर्म पॉपअप होगा। फॉर्म में बताए गए विवरण भरें। अब शिकायत फॉर्म में अपनी शिकायत का स्थान व विवरण दर्ज करें तथा अपनी यूएचआईडी सत्यापित करें। अंततः रेज न्यू ग्रीवेंस बटन पर क्लिक कर अपनी शिकायत की पुष्टि कर उसे दर्ज करें और अपनी शिकायत रेफरेंस नंबर नोट करें। इस तरह से आप अपनी शिकायत एम्स संतुष्ट पोर्टल पर दर्ज कर सकते हैं। जल्द ही आपको आपकी शिकायत के समाधान के लिए एम्स टीम का प्रतिनिधि उपलब्ध कराया जाएगा। इसके साथ ही आपकी शिकायत को समझकर उसका उपयुक्त निदान किया जाएगा। अंत में यदि आपको दिए गए निदान से संतुष्टि हो तो आप शिकायत के हाल की पुष्टि कर सकते हैं।
हर दिन देश के कोने कोने से आने वाले लाखों लोगों का इलाज करने वाला एम्स आपको आमंत्रित करता है। आइए और रोगी की सर्वोत्तम देखभाल, परिसर की स्वच्छता, पौष्टिक भोजन और बेहतर आतिथ्य के एम्स टीम के संकल्प को सिद्ध करने में एम्स टीम का सहयोग कीजिए। अपनी शिकायत दर्ज कीजिए, अपने सुझाव साझा कीजिए। आज ही संतुष्ट पोर्टल पर लॉगिन कीजिए। एम्स टीम तक अपनी शिकायत पहुंचाना अब हुआ आसान। संतुष्ट में है समाधान।
Thank you. Now we request our honorable guest of honor to click and dedicate these digital initiatives to the public. Next, we'll have the inauguration of the fire station at AIIMS, which is to augment the fire safety here. And it is going to be staffed by the Delhi Fire Services with 6 fire crew led by a sub-officer. Now we request our Minister, Jeev, to please inaugurate the fire station as well. Thank you, sir.
अब हम पुरस्कार वितरण आरंभ करेंगे। इसके लिए मैं मंच पर उपस्थित गणमान्य अतिथियों से निवेदन करती हूं कि वो आगे आएं। ये पुरस्कार शैक्षणिक उत्कृष्टता को सराहना करने के लिए विस्थापित किए गए हैं। They motivate the recipient and they inspire their peers and colleagues to also pursue such brilliance.
We request the awardees to please line up in the order that you've been asked to come forward. So the first award is the Dr. B.K. Anand Medal 2023 for the best postgraduate student in physiology, and it is awarded to Dr. Kavita Yadav. The Dr. Bodhraj Sabarwal Medal 2023 for the best postgraduate in ophthalmology is awarded to Dr. Antriksh Vahi. The Sanjeevani Medal 2023 for the best postgraduate student in anesthesiology is awarded to Dr. Yalla Bharat. Dr. Atma Prakash Medal 2023 for the best MBBS intern in surgery is awarded to Dr. Ayushi Bansal. Dr. Shyam Sharma Medal 2023 for the best postgraduate student in radiology is awarded to Dr. Srinivas SM. Dr. Jagdish Lal Kapila Medal 2023 for the best DM student in cardiology is awarded to Dr. Manjeet Mahendran. Dr. N.C. Nayak Medal 2023 in pathology for the best senior resident is awarded to Dr. Shraddhanjali Satpathy. Professor H.D. Tandon Medal 2023 in pathology for the best undergraduate student is awarded to Mr. Pankaj Kumar. Srimati Shankuntala Jolly Medal 2023 to the best DM Medical Oncology student is awarded to Dr. Akhil P. Santosh. And he is also awarded Mrs. Geeta Mittal Medal and Book Prize 2023 for clinical research. Dr. V. Ramalingaswamy Medal 2023 for the best junior resident in pathology is awarded to Dr. Riya Mahendru. Mrs. Geeta Mittal Medal and Book Prize 2023 for Basic Research is awarded to Dr. Divya Mohan. Srimati Kirpal Kaur Medal 2023 for the Best House Physician is awarded to Dr. Sankir Sadanand. The Colonel G.C. Tandon Medal 2023 for the Best Senior Resident in Anesthesiology is awarded to Dr. Vishnu Narayan M.R.
Dr. Shagun Kapoor gets the Professor V. Hingorani Medal 2023 for Best Clinical Resident in Obstetrics and Gynecology. She also gets the Srimati Leelavati Salwan Book Prize Award 2023 in Obstetrics and Gynecology for the Best Junior Resident for an outstanding research. Dr. S.V. Talekar Medal 2023 for Best Postgraduate Student in Biophysics goes to Dr. Lakshay Malhotra. Dr. S.S. Sidhu Medal 2023 in Dental Surgery for Best Postgraduate Student goes to Dr. Sehrish Khan. Dr. S.S. Sidhu Medal 2023 in Dental Surgery for Best Postgraduate Student goes to Dr. Shilpa Verma. The Hiralal Medal 2023 in Surgery for the Best Senior Resident Student goes to Dr. Mandli Bhanu Pradeep Yadav. Dr. Shreya Sharma gets the Dr. MMS Ahuja Book Prize Award 2023 for the Best DM Student in Endocrinology. The Manohar Lal Soni Book Prize Award 2023 to the best for the Best DM Neurology Student goes to Dr. Baikunt Panigrahi. Dr. Sagnik Biswas gets the Rakesh Tandon Book Prize for the Best DM Gastroenterology Student. Dr. Pavneet Kaur gets the Sorel Catherine Freeman Book Prize Award 2023 in Pediatrics for the Best Postgraduate Student. The Kamini Charity Trust Book Prize 2023 in Otorhinolaryngology for the Best MS Student goes to Dr. A. Mahesh Kumar. The Amazonians of America Book Prize Award 2023 for Best Nurse goes to Mukesh Kumar. The Amazonians of America Book Prize Award 2023 for Best Nurse in Community Care Nursing goes to Poonam Sinha.
As you know, there is a riveting exhibition on innovations in healthcare and medical education. And this exhibition posters have also been judged yesterday. And there are a few prizes for that. I'll start with the consolation prizes. Dr. R.P. Center for Ophthalmic Sciences. Dr. AIIRCH. And the College of Nursing. The College of Nursing. The third prize is awarded to the Department of Psychiatry. The second prize to the Department of Pediatrics. The best poster is awarded the first prize, the Department of Cardiovascular Radiology and Endovascular Interventions. Congratulations to all the winners. Lastly, there is a certificate of appreciation for the outstanding contribution towards the successful conduct of the 69th Institute Day exhibition to the KL Wig Center for Medical Education, Technology and Innovation. So please, if horticulture and staff. Thank you. Thank you for that wonderful round of applause to all the prize winners. Now I invite our guest of honor, Shri Prataprao Ganpatrao Jadhav ji, who is the Honorable Minister of State of Independent Charge for the Ministry of AYUSH and the Minister of State for Health and Family Welfare of the Government of India, to address the gathering. Sir.
CSIR के महानिदेशक एवं सचिव डॉक्टर एन कलईसेल्वी जी, श्री एम श्रीनिवास जी, निदेशक एवं CEO AIIMS, श्री डॉक्टर के वर्मा, डीन एकेडमिक्स AIIMS, डॉक्टर राकेश लोढ़ा जी, एसोसिएट डीन AIIMS, श्री गिरिजा प्रसाद, रजिस्ट्रार AIIMS, और समारोह में उपस्थित संस्थान के समस्त फैकल्टी मेंबर्स, अधिकारी, डॉक्टर्स एवं छात्र छात्राएं और सभी माननीय अतिथिगण। AIIMS नई दिल्ली न केवल चिकित्सा उत्कृष्टता और अनुसंधान की क्षमता का प्रतीक है, बल्कि यह हमारे राष्ट्र की वैश्विक मंच पर उत्कृष्टता प्राप्त करने की क्षमता का एक सजीव उदाहरण भी है। यहाँ के समर्पित डॉक्टरों, नर्सों, शोधकर्ताओं और कर्मचारियों ने हमारे नागरिकों के स्वास्थ्य और कल्याण को सुनिश्चित करने के लिए अथक प्रयास किए हैं। AIIMS नई दिल्ली हमेशा से ही अत्याधुनिक अनुसंधान, रोगी देखभाल और चिकित्सा शिक्षा में हमेशा अग्रणी रहा है। मुझे यह जानकर खुशी है कि इस संस्थान ने तकनीकी प्रगति को गले लगाया है, जिसमें आर्टिफिशियल इंटेलिजेंस से सहायता प्राप्त निदान से लेकर टेलीमेडिसिन तक की सुविधा है, जिससे गुणवत्तापूर्ण स्वास्थ्य सेवाएं हमारे देश के सबसे दूरस्थ कोनों तक भी पहुंचाई जा रही है। यह संस्थान के संस्थापकों की उस दूरदर्शी सोच को भी हमारा सलाम है, जिन्होंने एक स्वतंत्र भारत का सपना देखा था, जहां ज्ञान और प्रगति का फल फूल यहाँ पर फूल सके। AIIMS न केवल एक अत्याधुनिक उपचारों में उत्कृष्टता प्राप्त कर रहा है, बल्कि चिकित्सा अनुसंधान की सीमाओं को भी आगे बढ़ा रहा है। भविष्य के स्वास्थ्य सेवा नेतृत्वकर्ताओं को प्रशिक्षित कर रहा है और पूरे राष्ट्र में स्वास्थ्य सेवा प्रदान करने के मानकों को भी ऊंचा कर रहा है। AIIMS नई दिल्ली लंबे समय से चिकित्सा शिक्षा, अनुसंधान और स्वास्थ्य सेवा में एक प्रकाश स्तंभ के रूप में पहचाना जाता है, और यह सतत सीखने और विकास के प्रति प्रतिबद्धता ही इसे उस उल्लेखनीय स्थान तक ले गई है, जहां यह 2018 से निरंतर NIRF रैंकिंग में शीर्ष पर बना हुआ है। इस वर्ष के संस्थान दिवस की थीम स्वास्थ्य देखभाल और चिकित्सा शिक्षा में नवाचार AIIMS की इस प्रतिबद्धता को दर्शाती है कि यह चिकित्सा के क्षेत्र में न केवल भारत में बल्कि वैश्विक मंच पर अग्रणी बन रहा है। यह देखना उत्साहजनक है कि एम्स ने स्वास्थ्य देखभाल को बदलने के लिए तकनीक को अपनाया है। क्षमता निर्माण किसी भी संस्थान की प्रगति का आधार है। यह केवल संख्या बढ़ाने के बारे में ही नहीं, बल्कि राष्ट्र की मानव संसाधन क्षमता को बढ़ाने के बारे में है, जो किसी भी स्वास्थ्य सेवा प्रणाली का हृदय और आत्मा होते हैं। यह प्रतिभाओं को पोषित करने, नवाचार को बढ़ावा देने और सतत सुधार की संस्कृति को बढ़ावा देने के लिए एक समग्र दृष्टिकोण को समाहित करता है। मैं हमेशा मानता हूं कि एम्स की असली ताकत उनके डॉक्टरों, शोधकर्ताओं, नर्सों, तकनीशियों और उन सभी सहायक कर्मचारियों की प्रतिभा और समर्पण में है, जो पर्दे के पीछे लगातार अपना काम निष्ठा से करते रहते। ऐसे में क्षमता निर्माण केवल एक आवश्यकता नहीं, बल्कि एक जिम्मेदारी भी बन जाती है। मुझे यह जानकर खुशी हो रही है कि एम्स नई दिल्ली ने सुशासन की दिशा में महत्वपूर्ण प्रगति की है, जिसे पारदर्शिता, दक्षता और जवाबदेही सुनिश्चित की जा रही है। जैसा कि आदरणीय प्रधानमंत्री श्री मोदी जी कहते हैं कि जब किसी गरीब को सस्ते और बेहतरीन इलाज की सुविधा मिलती है तो उसका सिस्टम में विश्वास और मजबूत हो जाता है। उन्होंने कहा है कि बेहतर स्वास्थ्य सुविधाओं का अर्थ केवल बीमारियों के इलाज तक ही सीमित नहीं है, बल्कि सामाजिक न्याय दिलाने तक भी है। आदरणीय प्रधानमंत्री श्री मोदी जी के सक्षम नेतृत्व में और हमारे माननीय केंद्रीय स्वास्थ्य मंत्री श्री नड्डा जी के कुशल मार्गदर्शन में भारत सरकार देश के हर जिले में मेडिकल कॉलेज बनाने और सभी के लिए चिकित्सा शिक्षा को सुलभ बनाने का लगातार प्रयास कर रही है। आप सभी को ये जानकर खुशी होगी, आदरणीय प्रधानमंत्री जी के कुशल नेतृत्व में भारत सरकार ने चिकित्सा शिक्षा में महत्वपूर्ण उपलब्धियां हासिल की। आज देश में 23 एम्स स्थापित हो चुके हैं। पिछले 10 वर्ष के दौरान मेडिकल कॉलेजों की संख्या 387 से बढ़कर 766 हो गई है। 51,348 सीटों की तुलना में एमबीबीएस की सीटें बढ़कर 1,15,812 अब हो गई है और पीजी की सीटों की संख्या भी 31,185 से बढ़कर 2024-25 में 73,111 हो गई है। जैसे ही हम इस संस्थान के भविष्य को देखते हैं, हमें यह याद रखना चाहिए कि इसकी सबसे बड़ी संपत्ति यहाँ काम करने वाले लोग हैं और उनका समर्पण ही इसे आने वाले वर्षों में और ऊंचाई तक ले जाएगा। आज फार्मासिस्ट डे भी है, हम यहाँ पर फार्मासिस्ट डे भी मना रहे हैं। मैं इस अवसर पर सभी फार्मासिस्ट हमारे भाइयों और बहनों को शुभकामनाएं देता हूँ और हमारी एम्स की इस 59 की इस अवसर पर सभी यहाँ पर काम करने वाले सभी अधिकारी, कर्मचारी, डॉक्टर, नर्सेस, शोधकर्ता सभी को भी मैं बहुत बहुत शुभकामनाएं देता हूँ और मेरे 2 शब्द खत्म करता हूँ। धन्यवाद।
Thank you. Please sit down. We will have the vote of thanks by the registrar in a bit. You can interact with the dignitaries later. Thank you.
Good afternoon, everyone. Honorable guest of honor for the today's meeting, Honorable Minister of State, Independent Charge for the Ministry of AIIMS, and Minister of State for Health and Family Welfare, Government of India, Shri Prataprao, Ganpatrao, Jadhav ji, AIIMS Golden Jubilee Orator and Secretary of DSIR and Director General of CSIR, Dr. N. Kalaiselvi, Director of AIIMS, Professor M. Srinivas, Dean Academic, Professor Kalaiselvi, Associate Dean Academic, Professor Rakesh Lodha, distinguished guests, faculty colleagues, employees, residents, students, ladies and gentlemen. It is my privilege to extend vote of thanks on behalf of the AIIMS family for this remarkable occasion of Institute Day. First of all, I express my sincere thanks to the guest of honor, Shri Prataprao, Ganpatrao, Jadhav ji, Honorable Minister of State, Independent Charge for the Ministry of AIIMS, and Minister of State for Health and Family Welfare, Government of India, for sparing his valuable time for the Institute Foundation Day. Thank you, sir, for being with us and gracing the occasion. On behalf of the Institute, I thank Dr. N. Kalaiselvi, the Secretary of DSIR and Director General of CSIR, for delivering the AIIMS Golden Jubilee Oration. Thank you, Madam, for sparing your valuable time for us and for that inspiring oration. I also thank Professor M. Srinivas, the Director of AIIMS, for his constant encouragement and guidance, which made today's program possible. I extend my heartfelt thanks to the Dean Academic, Professor Kalaiselvi, and Associate Dean Academic, Professor Rakesh Lodha, for always being there to supervise any of the event we conduct here. Yesterday, apart from Professor Verma, Professor J.S. Titial, the Dean Research, Professor Naval Vikram, the Associate Dean Exam, Professor Sanjay Wadhwa, the Head of PMR, Professor Niskas Gupta from Onco Anesthesia, they all evaluated the posters of the exhibition. So a big thank you to all of you. We also thank the CMAT, various committees, audiovisual team for their efforts in planning, managing the exhibition, technical activities, cultural programs that is planned for today's evening. I take this opportunity to acknowledge the contribution of the exhibition committee and cultural committee chaired by Professor Kalpana Luthra from Biochemistry, Cafeteria Committee, Engineering Section, Media and Protocol Division, and of course, Tony and Archana, my good friends. I want to thank all the academic section staffs for their commendable efforts in organizing this event, and my special thanks to Mr. Hem and Mr. Ajay, hope they are there, and all other team members. We also thank the ministry for their timely support. We thank the members of our institution, students, faculty, staff members, particularly from sanitation, security personnel who contributed maximally to organize this event. Thank you very much. Thank you all.
Thank you very much, sir. Before we close for the day, I would like to remind you that this evening is the cultural program of the Institute Day, which will start at 6 o'clock, but there is a curtain raiser at 5:30 right here in the auditorium. And the exhibition on innovations in healthcare and medical technology is going to be on in the foyer till the 27th of September. So please take your opportunity to visit the exhibition and bring your friends and other people as well to visit it. Now we will stand for the national anthem, and we'll be led by Rishika, Rashmi, Khushi, and Vastavikta from the College of Nursing. Please do not clap after the national anthem. Thank you.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंग विंध्य हिमाचल यमुना गंगा उत्कल तरंगा तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे अब जय गाथा जय गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you. Please be seated. There is refreshments that are arranged over here in the common quadrangle next to the auditorium. For faculty and others, it is there on the second floor of the cafeteria, the central cafeteria. So please do partake of that and be here at 6 o'clock in the evening for the cultural program. There is a very good extravaganza that is organized. 5:30 for the curtain raiser. The exhibition is on till the 27th. Thank you very much.